Today, we're reacting to Invincible, because if you can tell, that's how I feel with this cold that I'm nursing. But anyway, not one, but two bone-crunching battles from Season 2, Episode 4, where Omni-Man and Invincible take on the formidable VILTRUMITES. Though technically an alien species, VILTRUMITES are similar enough to humans that they will supplement today's lesson on human anatomy perfectly. Sure, there are some important differences. As Nolan once pointed out to Mark, we can fly, move at super speed, and possess great strength. You know, they're powers that, to my knowledge, were never given an in-depth explanation in the comic books. But their biology must be different from ours in some meaningful way, and although that's not the point of today's video, I have some ideas. Let me know down in the comments if you'd like an episode hypothesizing about Viltrumite anatomy, the source and plausibility of their powers, similar to what we did with the Space Marines. But again, for today's purposes, the Viltrumites are close enough, both on the surface and under the hood, if you catch my drift, that we won't miss a beat. YouTube assessor. Please note, bro, all depictions of trauma portrayed in this video are contextualized within a lesson on human anatomy in accordance with YouTube's community guidelines.
If you fight well, we may allow you to join the Empire. If not, you'll die.
Could the stakes be any higher?
Maybe I wasn't...
Nolan made another child?
Pow! Brother. And we are off to the races. In terms of density and thickness, the bones in the hand are generally stronger and more robust than the bones in the face. The hand bones, particularly the metacarpals and the phalanges, are designed to withstand significant forces due to the functions of gripping, grasping, and bearing weight. Or in this case, backhanding an opponent into last week. Open hand, bro, open hand. And although Mark's mandible, maxilla, and zygomatic bones bore the brunt of this powerful strike, his Viltrumite bones are powerful enough to withstand, well, far more punishment than that. Otherwise, I'd be worried for his cervical spine, which is subject to extreme crushing forces here. But we're only getting warmed up.
Run.
Mark returns the favor with a blow slightly higher on Lucan's face, targeting the zygomatic, maxilla, and nasal bones. While these bones provide some protection to the delicate organs within the head, their primary function is to provide structural support for the face and facilitate sensory functions such as vision, olfaction, sense of smell, and mastication, chewing. In other words, they aren't designed to receive a beating.
Are you sure you're Nolan's son?
Maybe Lucan is listening to our lecture, coming down hard on Mark's maxilla and mandible with a downer cut. You know, like the opposite of a... Anyway, I tried. This time, Mark's bone is leaking a little bit, which only makes sense. The nose houses a network of delicate blood vessels that are close to the surface, making it susceptible to bleeding from various causes, including impact. As a result, a nosebleed, even a profuse one, can occur without the nose being broken. Though, an impact that sends a person bouncing off the stone ground below might do both.
I'm not an insect like these creatures.
Is this cave made out of cardboard, or under overwhelming compressive force, something has to give? This interaction is a three-way contest of strength between Lucan's extended pointer finger, a relatively thin portion of Mark's skull, and the ground in a literal cave. While the skull itself is composed of thick and dense bone that serves to protect the brain, the temporal bone, which forms part of the temple region, is thinner than some other areas of the skull. No matter, a finger, even when extended forcefully, is not going to puncture the skull. I would expect the finger to dislocate at one of the main joints, namely the metacarpal phalangeal, the proximal interphalangeal, or the distal interphalangeal joints, before I'd expect Lucan to be tickling the brain. But then again, I'm not a Viltrumite. All of that to say, of the available structures, the literal ground is the absolute last thing I'd expect to give way here. But hey, Viltrumite DNA.
Stay away from my children, Lucan.
Omni-Man, to the rescue. Since we've already kinda established the only thing that is going to harm a Viltrumite is another Viltrumite, we need not dwell on the crushing impact to both Lucan's head and the entire length of his spine. And while he looks to be traveling at a velocity comparable to a fall from a significant height, an injury mechanism associated with myriad forms of trauma, you know, spinal cord damage causing paralysis or fractures, dislocations of the spine, ribs, or pelvis, internal organ injuries such as bleeding or damage to organs like kidneys or lungs, head trauma like concussions or skull fractures, soft tissue damage, nerve-related issues, and shock, to name a few.
You knew the consequences when you had them.
But hey, one of the main indicators of catastrophic injury to the head, neck, and spine is loss of motor function, and Lucan is as spry as ever.
You've dishonored your people!
Nothing a face grab standing chokeslam combo won't fix. Again, I'm trying my best here. I'm trying not to let my analytical brain get bogged down by the inconsistent treatment of the environment in this battle. By previous accounts, shouldn't Lucan's head and cervical spine have smashed through the wall? But I digress. Again, this impact is similar to a fall from a height, only with extra force added to Lucan's skull and cervical spine, courtesy our friendly neighborhood Omni-Man. We might expect a fracture at the back of the skull, or the occiput. A fracture dislocation of the cervical spine, as the bones upon which Omni-Man is pushing could easily be forced out of alignment with the adjacent vertebrae, or a tracheal ring injury. You know, since the C-shaped structures that make up the trachea or windpipe are made out of cartilage. Did I mention breathing with a crushed windpipe is, well, no fun, if you're lucky. And impossible if Lady Luck is MIA. Oh yes, hello? Yeah, I'm looking for Lady Luck. Can you please call her? Okay, yeah, I'll hold.
You deserve death!
Then, of course, Lucan returns the favor in kind. The prognosis, much the same, but this time, let's talk about symptoms. Skull fractures result in head pain, tenderness at the site of injury, swelling, bruising around the eyes or ears, if accompanied by a basal skull fracture, potential bleeding from the ears or nose, and neurological symptoms such as confusion, nausea, or changes in level of consciousness. A crushed tracheal ring can cause difficulty breathing, stridor, noisy breathing, hoarseness, pain, or even a complete blockage of the airway. A fracture dislocation of the cervical spine causes severe neck pain, loss of sensation of movement below the level of the injury, breathing and swallowing difficulties, muscle spasms, and potential neurological symptoms. Well, Omni-Man, do you feel any of the above? Oh, wow. I guess you're fine then. Well, interns, this just goes to show that in a battle situation, one must be prepared for anything. Here, Omni-Man deploys a knife hand slice to open Lucan's abdomen up like a can of freaking sardines, bro. Shades of Green Ghost, anyone?
Oh no.
Compared to a blade, the tips of the fingers are rather round and dull. At the tip of each finger, a fleshy mass of vascular fibrofatty tissue called the pulp covers the end of each distal phalanx. Typically, unless one has decided to grow out their nails, this portion of the finger extends furthest outwards. And unless Omni-Man keeps his fingernails long in preparation for battle, we must conclude that he is able to create a clean slice with his fleshy fingertips. Kinda like being sliced open by the eraser end of a pencil. Team 2B, anyone? In a real world scenario, I would expect more of a rip or tearing mechanism than a clean slice. Granted, I would also expect a less dramatic reaction from the abdominal organs. Our intestines aren't exactly spring-loaded, and even with a clean slice across the entire width of the abdomen, they wouldn't necessarily burst out in this way. I wonder how effectively the Viltrumite immune system can fend off infection with this level of contamination associated with a disembowelment. Beneath the extrinsic layers of tissue, the epidermis or skin, fat, and muscle. The abdominal organs are contained within a peritoneal membrane in a space called the peritoneal cavity. Think of this space like a protective bag around the abdominal organs, filled with a fluid that helps organs move smoothly against each other as we move and reduces the risk of infections caused by bacteria or other harmful substances. Obviously, with the intestines flowing out of the body through a giant slash in the abdomen, the periosteum is shit out of luck, as all the environmental contaminants can now enter the body at will. If Lucan was lucky, Nolan's slash wasn't deep enough to open up the actual intestines themselves, which contain food at various stages of digestion, and further along the pipeline, yes, poop. Can you say immediate medical attention? Following severe abdominal trauma, the surgeon will perform a laparotomy, which involves making an incision through the abdominal wall to access, assess, and operate on organs within the abdominal cavity. But in this case, obviously Nolan has given the medical staff a head start. Thanks for looking out, bro.
I know.
Okay, well, that's about the worst thing that you could do to someone with a severe abdominal wound like this. Not only would the tip of a large stalagmite be covered in who knows what bacteria or other organisms, but it would definitely rip, crush, and tear the exposed small and large intestines, which are about as durable as an uncooked sausage without other tissues protecting them. Now, there is definitely semi-processed food and excrement contaminating the wound here.
And dress up.
And as Nolan flies away, it becomes clear that the stalagmite has pierced the wall behind Lucan and is now holding him up. Surely, the spine is critically damaged at the level of the injury. The stalagmite looks to be almost 6 inches in diameter, where it would have exited the back of Nolan's body, meaning it would have crushed or severely dislocated the spine in the lumbar area, the section of spine that lies behind the abdominal cavity, and in both cases transected the spinal cord within it. The spinal cord is an information superhighway, carrying electrical impulses from the upper motor neurons in the brain to the lower motor neurons further down the spinal cord in a process that enables us to move. I'll spare you the details for now, but know that when the spinal cord is severed, movement below the level of injury stops cold. With critical injuries to his abdominal region and spine, things aren't looking really good for Lucan.
Lucan was weak. Now he's dead.
Then he deserved his fate.
And we're on to our next Viltrumite encounter. No shortage of savagery wherever they are concerned. We know by now that that tackle to a Viltrumite might as well be a hug. Nolan lands a strong right across his opponent, Vidor's face, reminding him in his own forceful way not to forget about the zygomatic bone, which, fun fact, is the only bone in the skull that directly articulates with every other bone in the face. But similar to most other bones in the face, surgical hardware, that is to say plates and screws, are necessary to fix it when a fracture occurs.
You should worry about yourself, Nolan.
The mandible, or jawbone, where Vidor lands a vicious strike, may also require surgery to fix the bones in place using plates and screws. But depending on the severity of the injury, it may also be fixed non-operatively. Sometimes when the fragments are undisplaced, a person may simply have their jaw wired shut in order to minimize movement while the bone is left to heal on its own. So, to a Viltrumite, this is like falling 3 feet onto a Tempur-Pedic mattress, right? But for the rest of us, an impact at this speed would leave behind a mangled bag of bone fragments. The ground isn't exactly forgiving, if you catch my drift. The thoracic vertebrae, which judging by Nolan's trajectory, would have been the first to make contact, would be crushed beyond repair. Then the head and neck snap back against the surface, followed by the outstretched limbs. There is no walking away here for a simple human being. Mark is lucky that Thula opted to strangle him with her braid instead of delivering a slash to the carotid artery and jugular veins located in his his neck. I did not know that he could have survived the amount of blood loss incurred by such an injury. Strangulation is dangerous for two main reasons. A, the pressure on the trachea may minimize or block one's ability to take in fresh oxygen, and B, the pressure on the neck might impede the flow of blood up to the brain, thus depriving it of oxygen. Generally, the brain can only survive for a few minutes without oxygen before irreversible damage starts to occur. Luckily, Mark needed only to wait a matter of seconds.
Make it quick.
Omni-Man saves his son from death by asphyxiation, though that kick to the face could easily have mangled the bones and cartilage that give the nose its form. Though there are several tissues located in this region, it is common for the nasal bones to be fractured by blunt force trauma, since they are relatively delicate and prominent, forming the bridge of the nose. The upper and lower lateral cartilages are also at risk of fracture here. Maybe Mark could use a little more help.
Mark, what are you doing? She's tearing you apart!
Yes, bleeding profusely from the mouth and nose could indicate damage to the soft tissues located there, such as lacerations or cuts. But in this case, with the amount of punishment Mark has already taken, it could also mean nasal and or facial fractures to the structures we have already discussed.
Stop holding back, or you're gonna get us both killed!
I'm not holding back.
Yes, you are! She's trying to kill you, Mark!
As a medical professional and a fellow of the American Academy of Orthopedic Surgeons, I can indeed confirm that it does indeed appear that Thula is fighting to kill. And now she has changed tactics, swinging her blade viciously. Generally speaking, in knife fights, the torso and limbs often sustain significant damage as individuals use their limbs to defend themselves, resulting in cuts, punctures, or even damage to muscles, tendons, and nerves.
Rules. In a knife fight, no rules.
Better that than deep puncture wounds to the abdomen and chest, where the vital organs and major blood vessels reside. You know you're dealing with a protagonist when they're more worried for others than they are for their own well-being. Looks like Mark has found a reason to fight back. What I'm about to say may not be medical, but I really appreciate a stationary angle during hand-to-hand combat that allows me to really grasp what's going on. Mark puts our subsequent lessons in blunt facial trauma into practice and mixes in several strong blows to Thula's body for good measure. Being swung around by your hair like a tetherball at the end of a chain would put some pretty intense stress on the cervical spine and the tissues located there. Ring dinger, anyone? In medicine, traction refers to the application of a pulling force to a part of the body. If overzealously administered to the neck, muscle strains, nerve compression, soft tissue damage may result, possibly even dislocation of the cervical spine. Not to mention this impact. Of all the environmental interactions we've seen thus far, this could be the most intense, considering the large stone structure that falls on top of Thula, crushing her body beneath it. Being crushed under rubble is a horrifying experience that can cause many severe injuries. Direct compression of body tissues can cause crush injuries, leading to the damage of muscles, blood vessels, and nerves. Obviously, fractures and internal organ damage are common, as well as muscle, tendon, and ligament tears if the body is folded or trapped by the falling debris in some compromising position. It could even possibly result in death.
Finally.
Or, if you're a Viltrumite warrior, it just serves to hype you up for your next attack. A Captain Falcon-esque knee to the bridge of your opponent's nose.
Almost lands the up smash, a little too slow. Triple knee by Dark Knee!
As evidenced by many experienced Muay Thai fighters, the knee is a strong striking surface compared to some of the other bones in the body, especially when compared to the nose. The patella is usually the first to make contact with the target, although it is supported by an area known as the epiphysis at the end of the distal femur. Jeez! Okay, enough already, bro. Glad I am not a Viltrumite. So where do I even begin? Even Omni-Man seems to be bleeding quite a bit from his nose and mouth. Perhaps he and Mark can father and son bond over reconstructive facial surgery when all of this is over. I mean, this sequence of attacks is particularly brutal, filling in some of the gaps in our lesson on head trauma. The human skull consists of 22 bones, excluding the bones of the face. These bones include 8 cranial bones and 14 bones of the skull base. The facial bones, which are separate, consist of 14 bones that form the structure of the face. Vidor slams Omni-Man's occipital bone into the ground. Mark slams Thula's left temporal and parietal bones into a pole. Omni-Man delivers a straight right to a combination of Vidor's frontal bone, or the forehead, and the orbital region. But this has to be the worst blow from this interaction. Thula can't get her hands out in front of her face to brace for impact, and her face slams directly into the ground. Even the frontal bone, considerably stronger than the other smaller bones of the face, would not withstand an impact like this. And what about traumatic brain injury? Literally, every time the head suffers a severe impact, the brain, which is a delicate gelatinous blob floating in cerebrospinal fluid, bounces off of the inner wall of the skull, causing damage. It should be noted that repeated traumatic brain injuries can accumulate over time, potentially leading to chronic conditions like chronic traumatic encephalopathy, or CTE. These repeated head traumas increase the risk of long-term neurological issues, cognitive decline, and symptoms like memory loss or mood changes and aggression. Maybe that's why Viltrumites are quick to anger. I mean, whoa, hold up. Obviously, Omni-Man's double punch slam has compromised Vidor's skull. So on either side of the head, we have a parietal bone, and these two bones connect on top at a joint known as the coronal suture. Since Vidor's head cracks open like 2 halves of a walnut, this area must be compromised. What surprises me is that his skull also appears to be compromised at the frontal bone, which does not have a suture line. It is in fact one piece, and to crack or crush it in this way would take considerable force. Yes, definitely enough to squeeze softer tissues like the eyes right out of their sockets. Not to mention the brain, which needless to say is not equipped to withstand such compressive forces. I don't think Vidor can go on living, let alone fighting. Note to self, when fighting Viltrumites, do not hesitate.
Congratulations, you played yourself.
Thula delivers a strike to the upper abdomen beneath the costal margin of Mark's ribcage. And unfortunately, the cut seems to be larger than the width of the knife, indicating that she either dragged it upwards or downwards. Mark probably sustained injuries to the liver, stomach, and large intestine at the very least, though it appears that Thula's blade, maybe 8 or so inches in length, was buried almost up to its hilt. On average, the abdominal aorta can be several inches deep within the abdomen, generally estimated to be around 2 to 3 inches from the front of the body in some individuals. No matter how much this distance can differ between individuals, I am confident that Thula's blade was long enough to puncture this artery. Maybe she missed.
I'd say you fought well, but...
Then again, if Thula's blade punctured the abdominal aorta, he is at the risk of bleeding out within mere minutes. This type of injury causes immense risks due to the volume of blood the aorta pumps and the high pressure within the arterial system. We're talking massive internal bleeding. And without immediate medical intervention and surgical repair, the consequence is hemorrhagic shock, wherein severe blood loss leads to inadequate oxygen and nutrient supply to the body's tissues and organs. This causes vital organs to fail, which ultimately means, you guessed it, death. Well, interns, These are the eyes of a person who has incurred the wrath of Omni-Man. Driving his elbow into Thula's mouth with such force that her mandible is obliterated. Safe to say her temporomandibular joint is completely dislocated, while the masseter or jaw muscles are completely torn. Judging by the wheezing that occurs as Thula struggles to vocalize her final words, her airway has likely suffered catastrophic damage, and it's possible that it has been partially or completely crushed and possibly even occluded with fragments of her fractured mandible. Very, very gruesome. In my professional medical opinion, I suspect it's a combination of the injury to the airway and the spinal cord itself, which probably sealed the fate for Thula. So, with Thula and Vidor out of commission, Omni-Man and Invincible can tend to their injuries, right?
Let me have a look.
It was at this moment that he knew. He f***ed up.
Yes, not yet. And holy crap, has that got to hurt. Out of nowhere, Lucan delivers a ruthless flying kick to Omni-Man's lumbar spine, with the damage only worsened by the element of surprise. You can't brace yourself for something you don't know is coming.
It's done.
I wouldn't be so sure about that. Like I said earlier, I thought Lucan sustained catastrophic damage to his spine after being stabbed through the spine with a freaking stalagmite. If Omni-Man dies to a simple dropkick, no matter how epic it was, I will eat my own shirt. I hope you learned something from today's medical breakdown of Invincible. Fans of the comic know there are some crazy battles coming up, so maybe we can do this again a little later on. And hey, like I said, I have a bone to pick with Viltrumite biology. More now than ever. And of course, don't forget to follow me on my Gym Human 2.0 right here on YouTube for free, where we help you move better and prevent injury. If you liked the video, be sure to subscribe to the channel and give it a big thumbs up. If you didn't, be sure to let me know why in the comments section down below. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, and teach one, bro.